Assalamu alaikum. Hello, good morning to you all.
Waalaikumsalam, Doktor.
Morning, how are you all?
Alhamdulillah.
Okay, mashallah. I just got a notice that there's some student that entered the second session. Today we're supposed to have two sessions. The first one will start from 9 a.m. till 10. Then by 10:30, we'll start the second one till 11:30. So that's why I created two different meetings. Ordinarily, I would have left it as one, but you have to take a break of about 30 minutes before we start the second session. So that's why I created two sessions. Is the PIC here? The PIC, are you here?
Yes, Doctor.
Okay, please, can you inform your colleagues to please join this session? The second session will start by 10:30. So while waiting for them, I think so far I've received research titles from about 6 to 7 groups or so. So for the remaining groups, have you started working on your topics? Are you with me? Hello?
Yes, Doctor, we are working on it.
Okay, because the reason why I need the title is that I want to avoid a situation where we have two groups or more than two groups working on a similar project. So I'm just remaining groups. Once I get all the titles from all the groups, I will share the titles with you with the names or the group numbers so that we know which group is working on which project. So what I want to avoid is having two groups or more doing the same thing. So for some of you, I realize some of you will be doing a systematic review, and then there are others that will be using primary data. So both are acceptable. So in designing the rubric for the assessment, I have to modify the rubric or create two separate rubrics. One for the online surveys or any kind of primary research, and the other one should be for the secondary research, which is the systematic review or scoping review or whatever your supervisors decide to do. Okay? All right, can we start now?
Yes, okay.
Because I can see we have just 93 students instead of 106. So I'm just giving your colleagues some time to see if they can join before we proceed. But anyway, I think I'll just start. So today we are going to talk about types of research. So previously we've discussed about research, defined research as any systematic as a systematic investigation into an issue or a phenomenon in order to come to a new conclusion, either to validate what has been done previously or to come up with a new knowledge or to come up with solutions to address problems in the society. So later on, we discussed about how to do a literature review and in research, in human research. And then we talked about literature review. So today we are going to build on that. And we are going to talk about types of research. So conducting research, one thing you have to have at the back of your mind is what kind of research do you want to conduct? Because this is actually very important. If you have a good research question and the research question is not matched by a good or appropriate research type, then you may end up with a spurious conclusion. So in the process of designing your research, you always have to bear in mind what kind of research I have to conduct, because this is what will determine the validity as well as the reliability of your research findings. So the decision on what type of research you have to use to answer your research question will depend on the question. For example, if you are trying to investigate something that is entirely new, where there is little or no information at all or no existing data, it is more appropriate to use a qualitative research approach so that you you gain an insight into the issue and have a preliminary finding that you can use to then do a quantitative research later on. So the definition of qualitative and quantitative research, I will discuss that later. Research types can be categorized based on some certain criteria. I think for now, for the purpose of this lecture, I will talk about 4 major criteria. But there are other criteria that I use to categorize research. So the ones we are going to talk about here are the sources of the data, the purpose of the research study, the process or the procedure involved in data collection, and lastly, the outcomes. So you can categorize research based on all of these 4 criteria and even some other ones that I have not included in this lecture. Because for the purpose of this lecture, I think I just want you to focus on these 4. First one is classification of research based on the source of the data. Like we discussed during the literature search, the sources of what? Literature itself, we categorize them into what? Primary, secondary, and tertiary. But unlike that, in the classification of research, we have 2 major categories: the primary research and the secondary research. In primary research, what happens is that you conduct research by collecting data directly from the participants or the respondents. For example, you can directly observe your participants to note what the outcomes you want to investigate. You can conduct a survey by distributing a questionnaire to your respondents to complete. And then sometimes you can also review patient medical record. This has to do with pharmacy and other research. You can interview your respondents or have a focus group discussion with them. Focus group discussion is applicable in qualitative research, and it is usually a group of people from different disciplines that are drawn together to discuss and deliberate on an issue in order to gain a deep insight into the issue that is being ever investigated, or to provide solution or answer a research question from a multi perspective. So in this kind of study, you are going to have observations or findings or contributions from different group of people. And then the investigator is now saddled with the task of looking at all of these perspectives and rising them up with a conclusion to the or an answer to the research question. So another thing I forgot to mention is that in primary research, you're actually dealing with original data, data from the source. For example, if you are reviewing use of medications or assessing adherence to medication among your patients, if you give them a questionnaire to fill, so the information you get from that questionnaire is an original data, it's a first-hand data. Is this clear?
Clear at there.
All right,
Okay.
I'll share with you some examples, and I think during my tutorials on, is it Wednesday, I want to come up with some research, and then I'll ask you to categorize them based on certain criteria. So just pay attention to what I'm going to share with you now. I just spoke about this. If you want to measure adherence to medication among, say, diabetic patients who are attending primary healthcare clinic in Malaysia, one of the things you can do is to either give them a hand-to-hand by distributing the questionnaire, either hand-to-hand or by online survey. If the patient have smartphones, you can share the links to the survey with your patient, and they fill the questionnaire, and then you analyze the response that they fill. This is a data that you collected directly from the source. There is no intermediary between you, the researcher, and the source of the data. So this is an example of a primary research. Another one again, although this is mine, what I did was to survey hospitalized patients. Here, what I wanted looking at is use of antibiotics and the quality of antibiotic prescription. So I have to review the medical record of patients who were on admission of the survey. So based on this is also an example of a primary research, because I'm dealing with data directly from the patient source, from the patient record. Another example I put here is the online one. This was actually a survey among pharmacy students, finally a pharmacy countries, Malaysia, Indonesia, and Pakistan. So what we did here was to give the link of the questionnaire to the student to complete the questionnaire. So again, this is a primary research because we are dealing with data, a raw data we've collected from the source. So for primary research, the focus is what? The source of the data. Is it from a primary source, or are you using data that has been published, and then you want to review that to come up with a conclusion and to identify other areas of research that needs to be investigated? Lastly, I've talked about the first three I've highlighted. If you notice, they have something to do with what? Collecting data, using what? Questionnaire, or using numbers to describe what you are investigating, right? So for this last one, it's actually dealing with the qualitative nature of research. Qualitative, I will discuss that shortly. So for qualitative, when you collect or conduct interview or have focus group discussion with your respondents directly to collect the information, this is also an example of a primary research. Here, the investigators who are trying to look at fatigue in hospital nurses. Super nurse culture is a barrier to addressing problems, a qualitative interview study. So the interview was conducted among nurses. So what I'm saying in essence is that the data was taken directly from what? There was an interaction, a direct interaction between the researcher or the investigator and what? The people or the participant in the research. Beside this, sometimes you have a review of qualitative research. So that review of qualitative research pulls all published qualitative research, which is the primary data, and then summarize these to come up with another conclusion. Such summary or review, systematic review, scoping review, or narrative reviews are considered as what? secondary data. Okay. So here what you use is you use published or unpublished data. If you are able to have access to any unpublished data, you can as well include them in your reviews. And examples of secondary data include reviews, whether systematic, narrative, or scoping, and meta-analysis. Meta-analysis is actually a quantitative way of summarizing existing literature. What has been published, you pull the results together, of course, using advanced statistical methods to come up with a conclusion. So an example of a secondary research is this: pharmacist-led interventions to improve medication adherence among adults with diabetes, a systematic review and a meta-analysis. So here, what the investigators did is to look at 6 databases and collect all randomized controlled trials that were conducted to measure the impact of pharmacist-led interventions in order to see what is the impact of those interventions and what are the kind of studies, or what are the recommendations they need to make for future studies. So such studies are categorized as secondary research because they are using data that has been collected by someone else. The data is not collected directly by these investigators. They are actually working with the data that has been published in other research. So in other words, secondary research is actually the use of primary research data to generate new conclusions. So this is actually another systematic review. This is the first systematic review I published, and it involves pulling results of studies that have been published regarding methicillin-resistant Staphylococcus aureus in Nigeria. So this is like I said earlier, using the data of studies that have been published previously. So I did not have a direct contact with the source, the primary source of the research. I did not have records of the patient. I only pulled the result of the studies that have been published to get before that time, and then came up with a conclusion. So for the difference, you need to note the differences between a primary research and a secondary research, because I think I don't need to go over this. From what I've said earlier, you can see that the source of the data is actually in primary research, the investigator collects the data either by themselves or by employing someone to do the data collection for them. But the most important or the key thing is that there is a connection, there is a direct connection between the investigator and the respondents. Okay? The second aspect is for secondary research, usually you work using research data that has been collected by someone else. Example of primary research, I've said earlier, we have surveys, we have experimental studies, focus group interactions and interviews. For secondary research, here you are dealing with systematic reviews or meta-analysis. Both of them, whether primary or secondary, can be qualitative or quantitative in nature. Qualitative is dealing with the use of words to describe the phenomenon you want to investigate. Quantitative has to do with the use of quantity, amounts, numbers, frequencies to describe what you are investigating. And each one has its own merits and demerits. For primary research, the advantage of primary research is that you can control the quality and the variables, because what you put in your questionnaire or what you want to investigate from the review of patient medical record will direct what you find. And if you polish the study very well, you can actually come up with something that has high quality. But for secondary research, usually the quality of secondary research depends on the quality of the primary research that is used to come up with the conclusion. For primary research, the primary research is that it is time consuming and it is expensive, costly usually, compared in comparison to secondary research, because you may need to print questionnaires, you have to contact the patient, get to wait for a very long time before you reach your sample size and achieve other things. But for secondary data, what secondary data needs, the disadvantage, what you need in secondary data is access to the databases and then the time to search. So the disadvantage of this is that sometimes the information you find may not align with what you want to do, or they may be too broad for you to, and making the task more difficult for you to come up with a specific conclusion. Is this clear?
Yes, sir, that's clear.
Please, if you have any question, you stop me. Any question so far?
Can you repeat the quantity and qualitative?
Yeah, qualitative, I just talked about it briefly. I will talk about it later. For qualitative, we are using words, alphabets, sentences in words to describe the phenomenon you want to measure. Okay? For quantitative, look at the word quantitative. We are dealing with quantity. For example now, if you need to measure the blood pressure of your patient or to measure the glucose level of your patient, you're going to express that using numbers, right? So that is an example of a quantitative study. If you want to measure knowledge of your respondent towards something, usually you give them a questionnaire they fill, then you grade the questions, and then you grade the correct answers and see, okay, 30% of the respondent have good knowledge. Good knowledge meaning what? They have more than 80% of the score. The 80% there is representing what? The amount, the quantity. So such kind of research are called quantitative. But there are other researches that you can conduct and does not involve the use of numbers. You describe what the respondent have given you. Say, for example, another example is this. You want to investigate adherence to medication. Okay? So you can use qualitative studies to know why your respondents do not take their medications. For example, you may come up with a conclusion that respondents do not take the medication because of the fear of side effects. So you see, you just express the result without any numbers, right? So for quantitative, you want to show what proportion of the respondents do not take their medication due to fear of side effects. These two things are actually measuring different things. One is telling you why the respondents do not take their medications, and the other is telling you the number of, or the percentage of the respondents who do not take their medication because of the fear of side effects. Between the two, and there are other things that I will talk about in my next lecture, I think, when I talk about research methods. I hope this answers your question, sister.
Yes, sir. Thank you.
Okay, any other question? Or do I have questions in the chat box? Okay, so far none. Okay, so the second criteria you can use to classify research is the use of the purpose of the research. First, we have talked about the source of the data. Source of the data can be primary or secondary. Primary, first-hand or original data. Secondary, using data collected by other people. Okay. Example of primary has to do with prevalence studies. You have prevalence studies, cross-sectional studies that you conduct. For secondary research, you have systematic review and meta-analysis. So here we are talking, the next thing we have to talk about is the purpose, classification of research based on the purpose of the research. So here you can classify research into three aspects, three types. You have descriptive research, exploratory research, and analytical research. Based on the names, you can easily describe them. Descriptive means you are describing what has happened or what is happening currently. You are describing the characteristics of, say, maybe you have, now we are dealing with COVID-19. If you conduct a research to describe the characteristics of COVID-19 patients or the kind of symptoms that they manifest, you are actually describing this form of research, whether you put it in numbers or in just words. Either way, you are actually dealing with what? A descriptive research. The second type is exploratory. Exploratory, from the word, you are exploring, and you explore mostly when there is little or no information at all on that subject area. Analytical means you're analyzing what is happening, trying to link more than one variable to see the association between two variables and see how one can cause the other or one can contribute to the occurrence of the other variable. So let's talk about this one after the other. For descriptive research, the main priority is to answer a wide range of questions. What is it? Who is it? How? When? And why of a phenomenon. For example, you want to measure adherence among your patients. You may want to know what is the rate of adherence to medication among your diabetic patient, hypertensive patient, cancer patients, or patient with any kind of infection, taking antibiotics or any other kind of medication. Pain, if they are taking pain relievers, what is the level of adherence? That is, what is the prevalence of adherence to medication? Who is adherent? Who is adherent? You want to see what are the factors that are associated with adherence to medication. Okay, you may want to know why are they adherent or why they are not adherent to their medication. This has to come maybe through a qualitative investigation or using a wide range of options for them using quantitative research, so that you know the major reasons why your patients do not take their medication. So maybe you describe characteristics of the disease, maybe COVID-19, or if it's an adverse drug reaction, you describe the characteristics of the adverse drug reaction. What are the most common adverse drug reactions that occur in maybe, say, a hospital? What kind of patient experience this adverse drug reaction? This is all part of a descriptive research. You are describing what is happening or what has happened in the past. So, and a good example of this is prevalence studies, like the ones we have highlighted earlier. I think I have some examples here. One of these is this. Here, I was looking at the prevalence of hospital-acquired infections in 3 hospitals. What we want to see is that what is the rate of hospital-acquired infections among hospitalized patients. So it's descriptive in nature because we are describing the rate, the types of the infection. Then later on, we looked at things like the risk factors for infection. Risk factors, I think you talk about that when we discuss data analysis. But risk factors is just for you to see who are those people who are most likely to have an infection, or who are those people that are most likely to have the phenomenon you want to investigate. If you are dealing with adherence to medication, for example, who are those that are more likely to be non-adherent to medication? That is what you look at. If you are dealing with, say, for example, COVID-19, who are those patients who are most likely, or who are those people who are most likely to contract the infection? The second one is here, the one I published with your current 4th-year students. Here we look at the prevalence of dysmenorrhea and then see what are the common symptoms that students who experience dysmenorrhea have. How do they manage the dysmenorrhea? Do they use complementary medicines? Do they use analgesics or other forms of therapies? Then in addition, we also look at the effect of dysmenorrhea on academic activities. So in a way, we are actually describing what is happening among the students. The experiences of the student are what we described in this research. So such kind of research are called descriptive research. The second type based on the classification that when you classify research based on the purpose of the research, is exploratory. Exploratory means you are exploring. There is little or no information on the subject matter. And so exploratory is in a way like a preliminary investigation to gain some insight into the subject area, and then you generate hypotheses that will be further validated or confirmed in subsequent research. One good example is here, and usually for qualitative, it comes when you are trying to explore new areas or controversial issues. So for example, this one is using patient-public involvement to identify priority for research in long-term condition management. So what the authors want to do here is to identify new areas for research. So to do this, they have to engage in a form of public patient involvement, having a kind of discussion with both the public and the patients, in a way so that they know what are the issues they have and to identify what the priorities of research should be. So usually your concern in exploratory research is you want to come up with new information or just preliminary insight into what will be further validated using either a qualitative or a quantitative research subsequently. Do you have any question at this point? Or am I talking too fast? Dear students, can you hear me?
Maybe you are a little bit fast, but it's okay.
Okay, then I'll take it again. All right. I talked about descriptive research, right? That you can classify research based on the purpose of the research. If your purpose is to describe the phenomenon, what is happening, when and why, is actually descriptive in nature. Exploratory research is usually to gain insight into a subject matter that has not been extensively studied. In other words, it is a preliminary finding into a subject area, in an entirely new subject where there is little or no existing information. Okay? The third one is analytical. Analytical, we are trying to correlate, show the association between variables and see how one of these variables influences the other. So I talked about descriptive, and I said a classical example of descriptive study is prevalence studies. And I showed you two examples, one having to do with investigation into the occurrence of hospital-acquired infections. What is the rate of hospital-acquired infection? What are the types of hospital-acquired infection in your patient? This is what you look at in a descriptive study, okay? In the second study, I said we look at the prevalence of dysmenorrhea. That is, what is the rate of dysmenorrhea? We just describe the rates. And then what are the common symptoms that the patient or the student experience when they have dysmenorrhea? So we are describing just what is happening. This is not an exploration into a subject area that has not been studied. Dysmenorrhea is something that has been studied extensively. Hospital-acquired infection has also been studied extensively. But in these settings, we are describing how it is in our own setting. Okay? So this is what makes it descriptive. From the word descriptive, we are describing. It's a very simple, straightforward definition. The second one I talked about is the exploratory. Exploratory, you are exploring to gain an insight into the subject area, particularly when there is little or no information in that subject area. Okay? Usually you do this to generate hypotheses for future studies. And I gave you an example about this group of researchers who want to identify new areas for research by engaging in by engaging with the public and the patient to gain an insight into what are the new things that they want and what can the medical society or the medical professionals offer. And so by the time you mark this together, you'll be able to come up with major areas where research needs to be conducted. And one thing I forgot to mention is that for exploratory research, in most cases, it is usually qualitative in nature. It involves sitting down with selected members sample and then gaining an insight into what they think. But usually you sit or you invite, the participants you invite in such studies are usually people who are vast on the subject area. For example, if you're dealing with patients, this one is talking about patients with long-term conditions, which is In other words, called chronic conditions, diabetes, hypertension, cancer, and other things. So these are the kind of people that you discuss with, and then you understand what area of research need to be what? Explored. Is this clear?
Clear.
If it's not clear, tell me, I will explain again, okay? Or if you have any concern, please drop it in the chat box. The next one is analytical research. Usually like I said earlier, you want to see causality. What is the association between variables? Say, for example, you want to see the association between adherence to medication, to diabetic medication, and glycemic control. What you have to do is to collect data and see that that means in your data, you're going to have a column or a questionnaire that will measure adherence, and then you are going to have in your questionnaire a column where you record the glycemic level or the hemoglobin level or the blood glucose level of your patients. So at the end of the day, you want to see the association between these variables. Is it that patients who are more adherent to medication are more likely to have good glycemic level control, or patients who are non-adherent to medication are most likely to have a very high glucose level? Another example is, say, for example, it has been said that for COVID-19, patients with chronic condition, such as hepatitis, I said hepatitis, or hepatitis can be categorized as a chronic disease, diabetes, hypertension, cancer, are more likely to come down with what? COVID-19 infection. So what you have to do is you have to see a group of patients who have COVID-19 and another group who does not have COVID-19. A group of patients within the same population, are there those who have chronic disease and are there those who do not have chronic disease? So by the time you do this, you pull this population together, eventually you will be able to establish the association between the occurrence of COVID-19 and patients with chronic disease. This usually, I think you talk about this when you discuss analysis. There are certain kind of statistical tests that you use to establish the association between different variables. So the third method of classifying research is based on the process. Process here is dealing with how do you collect the data. Mind you, this is how you collect the data, not the source of the data. The source of the data is dealing with who do you collect the data from. Is it directly from the patient or from previous studies? Here you are talking about the process, quantitative research or qualitative research. And there is another group called mixed method research. Mixed method research is actually a mixture of both qualitative and quantitative research methods. For qualitative, you are actually measuring your variable using quantity or amounts. I made mention earlier. Example, I told you you have a patient or a group of patients who you want to investigate adherence to their medication. If you want to see how many of them are adherent to their medication, that is quantitative because you have to deal with numbers and quantity or amounts. If you want to explore the reasons why they do not adhere to medication and you want to explore it in depth, then you have to use what? Qualitative research. So one is actually dealing with what? Measuring your outcome or the phenomenon you want to explore using numbers, amounts, or something like numbers, frequency, or percentages. In qualitative, is actually a narrative description of what is happening, and it's usually in depth because I'll talk about the difference between them in my next lecture, the difference between qualitative and quantitative. Here I just put it briefly because I know I'll talk about it extensively in my next lecture with you. So if you have any question on this, I think we will talk about it when we discuss quality research methods. So an example of this kind of research here is for quantitative, this one that the first one here. the one dealing with the increased role of pharmacists in antimicrobial stewardship in English hospitals. If you look at it here, the investigators are actually describing the findings using numbers. Over 95% of the hospital provided empirical usage guidelines. Here again, we are talking about over 80% conducted yearly antimicrobial point prevalence studies. So if you look at it here, you are dealing with the numbers to describe your outcome or what you want to investigate. So this is actually an example of a quantitative research. In qualitative, this is an example where this can also be classified into this can also be classified as a exploratory research. So in other words, what I want to highlight here is that the classification sometimes can be you may have a research that you can classify based on all these different criteria falling into different research types. So you can have a research that is qualitative in nature, but it is exploratory in nature. You can have a research that is quantitative in nature and descriptive in nature, like this one. This one is quantitative and descriptive because they are just describing what is happening in English hospitals. In this case, is an exploratory one because the use of WhatsApp in out-of-hospital pharmacies and out-of-hours hospital services has not been deeply explored. So this group of researchers used a qualitative research approach to gain an insight into what do pharmacists about this, the experiences about these out-of-hours pharmacy services using WhatsApp. So based on these, they will come up with some hypotheses that can be confirmed using a quantitative research. Quantitative here, you have to quantify what proportion of pharmacists or what percentage of pharmacists agree with this or think about this or whatever phenomenon you want to measure. Is this okay? Or do you have any question? Should I take it again? Hello? Yes? Do you have questions?
So far, no.
So far, no, Doctor.
Okay, if you have any question, you just let me know. If you first, you let me know. Shall I re-explain it or just proceed?
Okay. Doctor, can you make the slide full screen?
Full screen, okay?
Thank you.
Oh, sorry, I've been talking about this sense. Okay, can you say it now?
Yes, Doctor.
Okay. Do I need to re-explain? Would you like me to explain the idea or I should proceed?
You should proceed. I think we all understand this. Thank you.
All right. So the last one is classification based on outcome. What is the outcome of the research? The first one we talked about is what? The source of the data. The second one we talked about is what? Can anyone remember?
Purpose.
The purpose, okay? Based on the purpose, how many types do we have?
We have 3 types.
All right. What and what?
Descriptive, exploratory, and analytical.
Okay. What do you understand about descriptive research?
We describe what is happening.
Okay.
We describe the
Excellent.
characteristics or state of at present.
Exploratory. What do you find? What do you do in exploratory research?
We explore new information if there's a little or that have currently.
Okay. How about analytical?
We do analysis data to understand a phenomenon.
To understand what?
A phenomenon.
To understand what? Can you come again?
A phenomenon.
What does that mean?
Maybe we want to know a certain issue or something, and then we collect some data, and I think did we do um, some observation, and we analyze what is what.
Okay. You analyze. Okay. What do you do when you analyze? What is the purpose of the analysis?
Then we can
Maybe we want to correlate with the causes, causalities.
Yes. So you want to
yes.
see the association between two or more variables. That's why you need to analyze and see if there's any association between, say, maybe I made an example about COVID-19 and the occurrence of COVID-19 in patients with chronic disease. So you have to see if there's any association between occurrence of COVID-19 in the general population and the presence of chronic diseases in your patients. That's an example of an analytical research. I talked about classification of research based on the process of data collection. And I said we have how many types?
3, Doctor.
Okay, what are the types?
Quantitative, qualitative, and mixed method.
All right, so what do you quantity? Look at the word. Always focus on the words. Quantity, quality.
Quantitative, a number, involve number.
Okay, what do you do? What do you do with numbers?
Amount of variables involve amount.
Any other opinion? So that I'm doing this to explore to see where you are having issues so that I can re-explain those parts again. Does anyone has an idea about what quantitative research is and what qualitative research is? Come, let me exit to see if there's any message in chat box.
Quantitative research is when we draw numbers as the main way to quantify the variable.
Okay,
but qualitative is how we want to measure some things like response, thinking. That's something that is not maybe quantified by numbers.
Right. I think I like that idea. You just flipped it, the opposite of it. Qualitative is dealing with numbers, frequencies, percentage, to describe a phenomenon, okay? Or to show an association between some variables of any phenomenon. The qualitative is actually a narration by the investigator, narrating in words to express what they understand from the data they collected. Usually the quantitative research is for you to answer the what question or how many. So we are dealing with numbers. What is the rate of what? Hospital-acquired infections among hospitalized patients. You have to express this in numbers. What is the rate of dysmenorrhea among students? This will come in numbers, right? But qualitative, you are going to describe what is happening without the use of numbers. Okay, it's not to quantify. One easy example I always use is if you want to know why your patients are not adherent to medication. Say you want to know if they don't want to take their medication due to fear of side effects, because or maybe they forget or some other things. You can use a qualitative approach to explore this. If you want to know the number of patients who do not take their medications because they are scared of side effects, then you have to use a quantitative, because the numbers are already thinking about quantity. If you want to know the number of patients who do not take their medication because they forget, this also has to do with quantitative. So in a nutshell, qualitative is answering the question of how or why. Why are you not adherent to your medication? The qualitative is dealing with what is the rate of non-adherence among your patient, or how many of your patients do not adhere to medication, to adhere to their medication, to their medications. Is this clear?
Clear, Doctor.
Okay, any other question? I have a few more minutes. I think my slide, just a few more slides to go. Any other question? I talked about mixed method. Did anyone observe I didn't talk about it? I listed it, but I didn't talk about it.
Yes, you didn't talk.
So I was expecting someone to bring it up. Please feel free in my class. I don't penalize anyone for showing me my mistake. I'm human and I make mistakes. So if there's anything you feel I explain and it's not clear, stop me and then I will do my best to address it. Okay?
Yes.
There is no penalty. We're all learning. I will learn from you. You will learn from me. Okay? For the mixed method, it's actually a combination of qualitative and quantitative research. Because there are some research questions that you cannot sufficiently address or answer using either a qualitative or a quantitative approach alone. So you may need to combine the two research methods in order to come up with an acceptable or generalizable conclusion about what you are investigating. So this usually occurs in, I think, in pharmacy research. It's rare to see studies that combine both methods. I'm not saying that there are not, but when you find them, they have to do mostly with social pharmacy issues. For clinical pharmacy or laboratory work, I think you have to just take, for most of them, those ones are most majorly quantitative. So for social pharmacy issues, mostly you explore using qualitative, sometimes with quantitative support. You confirm them or generalize them using quantitative research. So in those kind of research, you may find people who use mixed method to explore some of the research questions they want to answer some of the research questions they have to address. So, but the major issue with mixed method is which one should come first. Do you start with the qualitative or you want to start with quantitative? So let me hear your thought on this. Which one do you think should be the first? Qualitative, quantitative?
I think quantitative first, followed by qualitative.
Okay, why do you think so?
Because normally after we got the data collection from the quantitative method of research, and then we can do the qualitative description or reasoning based on the data that we get, from my opinion.
Accepted. Any other opinion? Is it possible to start with qualitative first and then back it up with quantitative? Can we? Please speak up so that we can round up the lecture. Can we start with qualitative first and then supplement it with quantitative? Is it possible?
I think so.
Okay, when is it possible?
The only thing I can think of is that, let's say that you want to study factors that cause a phenomenon,
Okay.
and so you start by surveying the subjects on what do they think the factors of this phenomenon are, and
All
after
right.
that, select the most the factors that the most people agree on, and quantifying that based on that.
Okay. I think this is excellent. Very. The only thing you left out, I think, brilliant idea. The only thing you left out is Usually you start with qualitative when there is little information on the subject area.
Yes.
Because it is will give you an insight, a deep insight into what is happening. And then you can use that as a form of exploration. You explore the problem and then you come up with quantitative to show the magnitude or the size of the problem or the issue that is being addressed. I think very good point, brother. Okay, so you can actually use both in either way. If you are studying a phenomenon that has existing data and you want to look at something else or something more deeply, you can start with quantitative so that you'll be able to narrow because one thing with qualitative is that it goes in depth into an issue, a specific issue. Unlike quantitative that you can look at the wide range of issues at the same time. In qualitative, you are looking at one issue, but you look at it deeply. So you can start with the quantitative to see what are the major ones, and then you want to go deep into them to see how, or to explain how severe or how big of an issue it is. Similarly, you can also start with qualitative, especially when you are dealing with a situation where there is little or no information. You come up with qualitative to see the most common ones, and then you use quantitative to quantify them to see the magnitude or the size of the issue. All right? So I think very good points. So lastly, the last one we need to talk about is classification of research based on outcomes. Based on outcomes, basically we have two types. You have the applied research and the fundamental or basic research. Fundamental or basic is usually a description of what it is, of what the problem is, like the ones I described earlier, like the prevalence studies you have to see what is the prevalence of COVID-19 among our patients. The exploratory ones also can be classified as fundamental research. The major difference is that in applied research, you are dealing with solutions to problems. Suppose now we have an issue. I presented one slide before now, which I think I'll put in my lecture slide when I update it, about the impact of pharmacies in improving medication adherence. That is an example of an applied research because we are trying to use pharmacist interventions to solve a problem that is what's happening in your patient. Your patient are not adherent to medication, so how do you address that problem? So if you look at adherence to medication alone, if you look at the prevalence of non-adherence and causes of non-adherence among your patient, basically you are looking at what? Fundamental or basic research. If you want to study the effects of some interventions to improve adherence in your patient, then you are dealing with an applied research because you are trying to find solutions to an existing problem in the society. Is this clear?
Yeah.
Sorry, I didn't put this, right? So I think basically that's all for my lecture. Do you have any question? Any question? Do you have any question? Or is there any question in the chat box?
Doctor, I don't really understand the applied research and fundamental or basic research. Can you repeat?
Okay, for fundamentals, you are trying to look at, say, maybe the magnitude of a problem. How big is a problem? Or what is the problem? For applied, you are finding solutions to those problems. So applied research, in other words, is an extension of fundamental research. Because in applied, you are finding solutions to those problems that has been highlighted in fundamental research. For example, your patients are not adherent to medication, maybe perhaps because they forget to take their medications. So do you have any kind of interventions that will remind your patients to take their medication at the appropriate time? So those kind of interventions, research with those kind of interventions to solve those kind of problems are categorized as applied research. The ones that explore or describe the magnitude of a problem are categorized under the fundamental research category. I hope this answers your question, sister.
I understand, Doctor. Thank you.
Okay. Any other question? Any question? Do you really understand the lecture? Feel free.
Yes, Doctor.
If I talk too fast or you didn't understand certain things, please stop me. That's my job. My duty is to describe it to the best of my ability so that you understand, or at least have an insight into what it is, so that when you read, you'll be able to comprehend the issues. Any question?
Doctor, what do you mean for the fundamental? What do you mean it look for the magnitude of the problem?
Yeah, as in, say for example now, if you want to say you want to look at the prevalence of, say, what can I use now? Prevalence of antibiotic resistance. Okay, it's going to be descriptive in nature. You want to see maybe, say, for an organism, say E. coli, what proportion of E. coli are resistant to third generation cephalosporins? So this is actually exploring. Another example is, say, maybe you have diabetic patients or hypertensive patients or a patient with CKD, and you want to see the level of adherence among your patients. So if you are describing the level of adherence or the rate of adherence and non-adherence, you're actually revealing the magnitude of the problem. If, say, for example, 70% of your patients do not adhere to their medication, this is actually showing how big of a problem it is. So that's what you do in the fundamentals. So you're trying to reveal the size of the problem and the magnitude of the problem. Now we have COVID-19. Suppose maybe we don't pray for anything. In a state, say maybe let me use Pahang as an example. The government decide to undertake a study to see the prevalence of COVID-19 in Pahang, or prevalence of cancer in Pahang. Or let's use an example, say prevalence of breast cancer among women. You want to see how big of a problem it is. If you survey, say, maybe 1,000 patients, and then you have 100 patients with breast cancer, you know that the prevalence is going to be what, 10%. This is actually showing how big or small the problem is. If you have, say, maybe 40%, 50%, you know, okay, this is actually a big issue. And then you want to see what are the things that are contributing to the occurrence of cancer. This is all at the fundamental or basic level. By the time you want to profile solutions to prevent the occurrence of cancer in your patient, then you're actually dealing with the applied stage already. Is this clear?
Okay, clear, Doctor. Thank you very much.
All right, you're most welcome. I've taken 6 minutes of your time, so don't worry. I'll give you 6 extra minutes before others will start by 10:36. Any other question? Or do you want me to proceed with the next lecture? I finished 30 minutes earlier, and then you can leave. You can go on break early. Do you want to go for the break first?
Break first, Doctor.
All right. So I've taken 7 minutes of your time. So can we start? We will reconvene by 10:37.
Okay.
All right.
Thank you, Doctor.
We'll see you by that time.